Good morning, everyone. As you know, I'm Miguel with eXp Realty on Moonridge and hoping to be known more than just a realtor, so I come with these videos. With me today, we have Scott Sirico, and I thought the first segment for the hospital would be great to talk about some community education and the things that the hospital does and what Scott does specifically. So Scott, in brief words, tell us about what's going on on the mountain and with you and what you do.
So lots going on the mountain. So first of all, I've been an RN for 25 years, and I've been a Big Bear full-time resident for the last 4. Working here at the hospital for that time. And so my position here, I have 2 positions. I am the Director of Patient Care Management, and I am the Director of Nursing Education. So my first title, I am in charge of our case managers, our clinical managers, and our patient navigators here in the hospital. And our goals and our job here is to make sure that all the services that we have here at the hospital are accessible to our community and to our visitors. So my case managers make sure that if we have a resident who has had a hospitalization, they need more rehab, inpatient rehab, we have a swing program, they make sure that they can get up here, get approved by their insurance, and be close to home. Because one of the worst things to have happen is have to do a 6-week course of antibiotics or physical therapy in a skilled nursing facility and be down the mountain when your family's up here. It's very disruptive to the care. The patients then want to rush their rehab because they want to get home, not to be a burden to their family. So having that here in our community allows those patients to rehab with their family visiting every day. We also recruit for our long-term residential SNF. So that is for custodial care, those of our residents who can't manage at home alone and they need that inpatient care. And we make sure that we when a bed's open, that we take the next person and get them admitted so that, again, they can be by their family up here on the mountain. Or some of our residents just didn't want to leave the mountain. They were born and raised here, and the last thing they wanted to do was spend the rest of the end of their life down the hill. We have IV services, blood transfusion services, wound services, so outpatient services that we do here at the hospital location, not at the clinic. Our case managers and clinical managers arrange that, make sure that all of the approvals are done so we can get those people in here and help them. So that's what, and then of course our case managers are here to make sure that our inpatients have a safe and appropriate discharge, have what they need when they go home.
Circling back, how many beds do you have here?
So we have 20 residential skilled nursing beds. Okay. We have 8 acute beds that we use for the swing patients at rehab. We use for the medical stabilization program, which is a voluntary detox program, and for our regular acute med-surg patients. And then we have 1 bed that kind of swings back and forth. But right now we've been using it mostly for our inpatient acute unit. So we're running about 9 patients right now. Today we have 8 patients in inpatient.
Okay, sounds great. And when you say access for everyone, does that include veterans too?
It absolutely does. We actually just secured a contract with TRICARE West, or the VA, and so we actually have we still have a veteran here for doing rehab, and we have another veteran that is coming in later to do that, and then of course they can access our ER, outpatient services, and other programs.
Fantastic. And then I understand you have an OBGYN as well, right? Not a maternity ward, but an OBGYN that comes in?
We don't have one right now.
Oh, no, okay.
Yeah, we are trying to recruit an OBGYN, but we don't. But I will tell you, my other position, the Director of Education, we are working right now with a company to bring in education for OB emergencies so that our ER will be what Medicare considers OB ready. So that our nurses will have the skills they need so that if any of our community or visitors come in with an OB emergency, and that's not just labor, that could be anything, from bleeding to high blood pressure, that our nurses will be ready. So what we will be doing is giving them training, and then we will be doing mock OB emergencies once a month to keep them ready, because we don't get very many up here. Most of our residents who are pregnant and delivering, they know where they're going, they know when to go, and they get to their laboring, facility when they need to. But there's always a couple times a year where they can't make it, they end up in the ER, and rather than having our nurses and doctors, only see 2 a year, so they're just not as keen. We're going to have monthly training and mock scenarios so that when you come in, and have that emergency, they've been doing this. Maybe not on a real person, but they've been doing this, so they know exactly what to ask, what to assess, what to order, and how to get you to the proper.
Before we go to your second role, is there anything that you'd like to let the community know that maybe they're not aware of that you feel should be known?
Yeah. So one of the biggest things that happened in December is a year ago, and I've been out talking with the community, with the Rotary, the Senior Center, and other organizations. We really started vamping up our stroke program and our stroke education. And so we've been out educating on that and ready to treat any walk-in that is having stroke symptoms. But we were not a stroke receiving center, which means the paramedics could not bring a stroke patient here. So what they would do is take them to the airport and fly them down to Loma Linda or Arrowhead or wherever. We are now a stroke-ready receiving center with ISMA, with our EMS services. So now the paramedics will bring you here, and that is huge because that's going to eliminate that flight time. We're going to start treatment 20 minutes earlier, and 20 minutes of treatment is 20 minutes of saving that part of the brain. So our residents who may unfortunately be having a stroke are going to have a much better outcome if they call 911 and get here right away so that we can start treatment immediately. Our treatment times for people that qualify for treatment are less than 30 minutes, which is huge.
Wow.
The national average is 45.
Yeah. Again, like I said in the video when we were covering Measure U, my wife and I have used this facility 3 separate times, one during COVID. You guys did amazing work on us. The staff was phenomenal. So this is one of the reasons why I wanted to start doing these videos so people understood the hospital, not just get hearsay, but hear directly from all of you. We're gonna, I think, separate the 2 positions you have.
Okay.
We're gonna stop here. So guys, stay tuned. I hope you like it, and we'll talk soon. Bye-bye. Thank you.
You're welcome. My pleasure.